Good afternoon, everyone. Welcome to our first Chamber Talk with Torrie. I'm Torrie Griggs. I'm the Executive Director of the Boardman Chamber of Commerce. I'm excited to be offering this new opportunity to our members and local community partners. And joining me today is Brian Sims, CEO of Good Shepherd Healthcare System. Sims joined Good Shepherd Healthcare System as President and CEO October 1st of 2020. So you are coming up on your 2-year anniversary as the CEO.
In 2 days.
Exactly. Congratulations on that. Exactly.
Is this the 30th or what is this?
Today's the 29th.
2 days.
2 days, right? So, little bio on Sims. Sims has over 10 years of executive leadership experience, including 5 years as the CEO of a 25-bed critical access hospital and 5 years at an administrative office responsible for physician recruitment, contracting, hospital foundation, and business development. That sounds like it fits right into Good Shepherd Healthcare System to us. So welcome today.
Thank you. It's an honor to be here.
Yeah.
Thanks for having me.
I'm just happy to have you as my first person. We were just sitting here before we went live to say, this is my first one and I'm looking forward to it, and we'll see how it goes. So exciting. So today we plan to discuss patient care philosophy, your community health needs assessment that you guys just completed, and what is happening at Good Shepherd Hospital. So it's kind of exciting. So let's just get started on that patient philosophy. What's that patient care philosophy look like, and where's that going?
Well, we talk about the experiences that I've had, but it actually started when I was 10 years old. I was raised by a nurse, and my mom was a single parent, and I actually slept in a hospital one night in Jonesboro, Arkansas. So I actually had a first-hand view of what a good patient experience would look like.
Mm-hmm.
And for a long time, I thought I would never work in healthcare because I didn't feel like I had what it took, because I would see those nurses and the doctors
Mm-hmm.
and all of those healthcare providers come to work day in and day out and sometimes just leave their heart on the floor.
Yeah.
And I said, I just don't have that. And, as luck would have it, eventually I wound right back where I was supposed to be anyway.
Right.
But from those experiences is that, first of all, I always believe that we have to listen to the voices of our patients, the voice of our physicians, the voices of our staff, and
Mm-hmm.
actually more the voices of our community.
Absolutely.
And figure, okay, how can we do better? But at the heart of the philosophy, and people hear me say it all the time, our primary job is to ensure that our patients and their families feel just a little bit better going out the door than when they came in.
Absolutely.
And that's not medicine.
No, that's care.
That's care. We sure are glad to see you today.
Yeah.
That we're going to figure this out.
Mm-hmm.
And we're going to be right here with you. And that's what healthcare for me is all about. This morning we had, through our chaplain service, we had our first annual Soul Care Summit right in Hermiston. And that actually brought in all of our local pastors and ministers and to gather around and talk about what is soul care. I have a basic belief that our job is to provide health care, well care, and soul care.
That's soul care. That's cool.
That's total care.
That is total care.
And that's what we are really focused on.
Mm-hmm.
And this morning was a great event, and I know our ministers across the community was just very appreciative to be part of it, because we want them to be partners and to be able to come in and take care of their
Mm-hmm.
parishioners and to try to minister to their needs.
Mm-hmm.
So at the end of the day, I'm very excited for the future of where Good Shepherd is going.
That's exciting. That is exciting. That you being raised by a nurse, you understand the blood, sweat and tears you put into it.
Oh, yeah.
And to be able to come back and at an administrative level, what's that look like for you guys at the administrative level on bringing that patient care and supporting your staff on that?
I have well, thank you for asking that because some of the experiences I had, I actually spent 20 years in the Air Force.
Oh.
And that's how far away from healthcare I wanted to get.
Right.
And lo and behold, I got into recruiting for the Air Force, and the Air Force recruits its own health professions, including administrators and dentists and pharmacists and you name it. If it's in a hospital, it's in the Air Force. And so one day, we was listening to a couple of recruiters, and they were trying to, they were trying to help a doctor understand what the Air Force is about and what it would do for him. And I said, well, did you say da 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 da? And well, no. And it's like, well, how do you know that? I go, well, I kind of, and in the wisdom of the Air Force, they made me a health professions recruiter. And from there, the philosophy really started to develop. And one of those philosophies was, I learned from General Curtis LeMay, who was the father of the Strategic Air Command and very well respected. He had this philosophy: if you take care of the people will take care of the mission. And that really is my philosophy. I believe that my job, our administrators' jobs, is to ensure that we serve those that serve the patients. And we try very hard to ensure that we're meeting the needs of our staff and our physicians and so on and so forth, because they're the ones that are taking care of our patients.
Absolutely.
And that's how we do our part in ensuring that our patients and their families feel a little bit better going out the door than when they came in, is by serving our staff the best we possibly can. And I will be the first one to tell you, we're not perfect. We make errors along the way. But again, that's that part of listening to the voice of your staff, listening to the voice of your physician. And we continue to hopefully get better every day. And I ask for constant feedback, because I think that's important as well, is to get that feedback so we can figure, okay, how can we do better?
Feedback's always a great way to learn and grow and improve.
Correct.
Perfect. Well, I just want to say once again, I have Brian Sam, CEO of the Good Shepherd Healthcare System, joining me today. I did put in the comments that's pinned at the top, is that if they do have any questions, they are welcome to drop them in the comment section. I will be following those, and we will get to those comments at the end of today.
Very good.
I'm going to make sure that I can see what's going on as well. So let's see. Perfect. All right. I see that we have a few comments, and thank you for everybody that's joining us. We have 7 on the line. I'm just going to check our sound. We're good. So moving forward, so when you talk about philosophy, patient care philosophy and stuff like that, being new and being your second year coming in, you guys did a community health needs assessment. What did you guys learn from that?
Well, the community health needs assessment is required every 3 years.
Okay.
And from the community health needs assessment, we do an implementation plan to answer the concerns that come out in the survey. This year, the survey said that we need to focus more on behavioral health, mental health.
Mental health is huge.
Child and adult obesity, physical activity, that kind of stuff. And also just overall wellness for men, women, and children. So with that, we have implemented the implementation plan itself, and where we're trying to focus on different areas, such as lower the rates of suicide in Umatilla and Morrow County, reduce the number of folks that test positive for diabetes, encourage people to exercise more, put programs in place where they eat fruits and vegetables and so on and so forth. And as far as behavioral health, to introduce more like smoking cessation programs where people don't smoke anymore, or the same thing with alcohol abuse. These are the things that that really kind of came out during the survey itself. So over the next 3 years, We're going to measure it. We're going to figure out, okay, what do we need to do better in helping these numbers to go the right direction? And we will be reporting those out ever so often.
Right. Regarding mental health is probably a discussion that we hear pretty much monthly, daily in our everyday life, especially post-COVID with mental health. What is that looking like with you guys, with the healthcare system? I mean, what are you guys going to do directly with that mental health part?
That's a great question. First of all, I want to say that mental health is not a Umatilla or Morrow County issue. It's not an Oregon issue. It's a national issue.
Globally.
And I've experienced this no matter where I've been, where we just don't have enough resources for mental health.
Yeah.
Coming up soon, we're going to have our annual community update for the community. It's going to be online. And this year I've invited Karen Wheeler from Gobi that is going to give a presentation on behavioral and mental health. We just feel like that this is so doggone important.
It is.
Some of the things that we're trying to do right now is we developed a really good partner with CCS.
Yep.
And we're also in the process of recruiting a psychiatrist for our clinic for outpatient services. But with CCS, what we're really looking for is to have a caseworker, a counselor, somebody that can go from clinic to clinic and even to our ER for when folks show up in crisis, and to where we can immediately start addressing the issue.
Yeah.
These things are very important. You just cannot just push it aside because it's not going to go away.
No, absolutely not. And for our viewers that don't know what CCS is, that's Community Counseling Solutions. They're known here within Boardman and Umatilla and around our region now. They are really expanding their services, and they are a great partner. So
they are wonderful.
They are.
They're absolutely wonderful.
Yep, they
I'm
are.
so proud to be in partnership with them.
Yeah. So do you, with the obesity and the diabetes and stuff like that, that's kind of health and kind of encourage exercise and stuff like that. Do you guys have things planned to do that for community engagement stuff and in support of that? Or is there a spot where there is support that could be done through there?
Yes, and those are things that we are exploring right now, and how can we be more proactive versus reactive. And that's really what wellness is all about.
Yeah.
How can we be proactive? So we're looking at different things that proactively work with, like our city, with our communities, with different partners like CCS and so on and so forth. So we have dietitians, and we have an endocrinologist that's coming on board in the next couple of weeks. So that kind of helps with the whole diabetes management, and it's not going to resolve itself overnight, but we are absolutely focused on it.
Yeah. So if you are a viewer today, or you have a family member or something, and they are interested in getting into the dietitian, how do they get into that dietitian? And how do they get those meetings in there and get to know that dietitian and start that support?
Well, if it's like for diabetes, and because there's education, and it used to be 10 classes, and I think it's been whittled down to like 3 or 5 classes. I'm not exactly sure anymore. But with diabetes education, it's a matter of talking to your primary care provider, getting the referral, and then calling diabetes education. But normally, they'll set the classes up for you through a referral clerk in your primary care provider's office.
Perfect. So any primary care provider in the area can refer back to that program and get that going.
Absolutely.
That's great to know. Perfect. So we're just kind of following once again. I have Brian Sims today joining me for Chamber Talk with Torrie. It's our first one, so I'm excited. It's a good conversation so far. Anything you want to add to that community health assessment?
Other than, like I said, that we're going to continue to evaluate with like every plan. A plan is a living document. It's not static. As we achieve success, we will expand what we're doing. I have this basic saying that I think a lot of my staff at Good Shepherd have probably heard this till no end, that everything's an evolution, not a revolution.
Yeah.
And so we're just going to continue to evolve to where we can proactively take care of our community better than what we've done yesterday, and hopefully do it better tomorrow.
Perfect. That's a great way to go about it.
Yeah.
Yep. I like that. So moving forward in our conversation, so what's happening at Good Shepherd? What do we got? I see we got some stuff down on Main Street in Hermiston, the urgent care, and what else is coming? What's happening at Good
Well,
Shepherd?
That's a good start. I mean, we're looking at expanding and putting a state-of-the-art urgent care center right on Highway 395. We feel that that is going to be a really good place for folks to conveniently come in. I don't feel like where we're at right now is very convenient for our patients, and so we want to try to make it as convenient as possible. Right now, they're in the process, and hopefully in the next week or so, hopefully, the old Toyota building will be coming down.
Oh, okay.
Yeah, and then we're going to be able to go from there.
Start all over.
Start from there.
Yeah.
Some of the other things, just in the last year, we have really made an investment in robotic surgery. Our general surgeons just recently picked up a robotic, it's called a Da Vinci robot. It does all surgery with the physician, and it's it is state of the art. The surgeon is still doing the surgery. It's a little different.
Not as much hands-on.
Well, it's still the surgeon doing it. The difference is that it really promotes healing, because the incisions are real teeny tiny.
Less invasive.
So it's very less invasive. And so that really kind of promotes quicker healings and so on and so forth. The other thing that we invested in is called a Mako robot, and that's for orthopedic surgery.
Is that Dr. Anderson?
That Dr. Anderson and Dr. Whittam.
Okay.
And with the Mako, it's able to make very precise cuts.
Okay.
And very precise. And I mean, because there's a lot of times when you're doing orthopedic joint replacements, there's a lot of measurements and stuff that have to go into play.
Yeah.
And with the Mako, it's very precise. So it's state of the art. We have, just within the last year, we put in a brand new MRI. I mean, it is top of the line, state of the art MRI, and we're currently now putting in a new CT.
Oh, okay.
So again, we are reinvesting back into our equipment, and so that's a very important thing for us to do.
Yeah.
And in fact, our strategy is to reinvest in our equipment, in our facilities, and in our people. And so those are the things that we really look at, is how to better invest in all those things. Because like for us with our folks, it's no secret that staffing has been an issue across all the industries.
Absolutely, yeah.
And
it's a
so
shortage.
We're trying to figure out a way to better invest into our own staff, but also to help other folks in the community that would maybe like to get into healthcare.
Yep.
So we're looking at different programs right now and how we can help folks get into healthcare. And
so does that healthcare stuff, like getting into healthcare, is that kind of internship programs? What's that look like? What is that? How do
it's
you?
all encompassing.
All encompassing.
Just internships, or folks that just want to go to college, and somehow we figure out a way through the foundation, through Good Shepherd, we find a way to help that. And so we're having these discussions right now. Actually, I call this program the GET program: Grow, Educate, and Train.
Grow your own.
That's it. And
Grow
that's
your
exactly
own.
what we're
Exactly.
wanting to do, is grow our own, because we figured that if the community is going to invest in us, we need to invest in the community.
Yep.
And this is one way that we can actually do both at the same time.
Yep. We have a big philosophy of that around here with our workforce development
Yes.
for the Port Moro. We have a really true drive to keep these internship programs at all levels, high school to college, to
Yeah.
grow our own. I mean, because there's nothing better than bringing a kid back that's invested in the community, born and raised, has the connections, they come back and work. It's just a great thing to see the full circle of that happening.
And to that end, we are also working on some partnerships with some local schools to where we can actually go in and give presentations on like medical occupations.
Yeah.
You know, that's probably for myself when I was a kid growing up in a hospital. The only thing I thought there was in a hospital was nurses and doctors and people that came in and made the bed up.
Right, exactly.
And that's all I knew.
Same.
It wasn't until after I had moved on and I realized that all of these different occupations,
Yeah.
even finance, marketing,
Dictation,
human
billing.
resources, transcriptions, coding,
Absolutely.
all that stuff
Yeah.
that is in a facility,
Mm-hmm.
and I didn't know that. So
I agree.
I-
I've had the same conversation with friends and family members and saying, back in the day when I was in high school, I wish we had these internship
Yeah.
programs and these opportunities where people came in and told us about all these little bits and
Yes.
pieces that make this one entity as good as it is, but there's all these little supporting positions that there's so much more out there to offer that people can go get an education for now, and especially with these technical degrees you can get now
Mhm.
that take you directly into the line that you want instead of just going to college for 4 years and all of a sudden
Right.
going, well, what do I do now?
Exactly right.
Yeah.
And, you know, truthfully, when, after 20 years in the Air Force, I still wasn't really sure what I wanted to do when I grew up.
All right.
And it took a while, but, you know, again, it seemed like everything led me back to where I should have been all along.
All along, healthcare.
Yeah, exactly right.
Yeah. So your mom was a nurse and then you came back at the administrative level though,
Yep,
in healthcare, because
Yeah.
you saw what life was like maybe and indirectly not thinking about it and going into the Air Force and then coming back in administrative level.
well, and, you know, even after I left the Air Force, when I got the first phone call from a recruiter to interview as an HR professional, as an HR leader, to lead a hospital in the realm of HR. And when I got that first phone call, I said, no, I'm not interested. I don't want to do that. And, you know, it just, one thing just kind of led to another.
Mhm.
And it just continued. And the more I worked, the more responsibilities I got.
Mhm.
And then one day somebody called me and says, well, we want you to apply to be a CEO. I go, I don't want to do that.
All right. Why
So,
not?
Yeah, but here I am.
Right, here you are.
Because I listened.
Yeah.
To someone, and, you know, I'm very thankful that I did, because I had this I got this, my own philosophy, my own personal philosophy is that if you do what fuels your passion, you'll never work again.
That's very true.
And I'm very passionate about what we do.
I hear you there, because that's where I am at my job. I'm very passionate about my job. I love what I do. And I actually enjoy going to work every day, and getting to
Yeah.
talk to people
Isn't
like
that
you.
great? And you know what, and that's it, you know, I've talked to people that have to go to work. I get to go to work.
I get exactly. We get to go to work.
Yeah,
Yes.
and that's a good feeling.
It is a great feeling. Yeah. Well, that is wonderful. So once again, Brian Sims with Good Shepherd Healthcare System is joining me today. If you have any questions for us for our conversation, drop them in our chat. So anything else? It looks like we have a pretty good following. Nice thing is that people can come back if they can't watch it at their lunchtime. They can watch it again later. I've been excited. Anything else you want to add? Anything else that's happening? Any more expansions?
You know, nothing that I would want to talk about right now. We've got some things in
The word?
Yeah, in the works. Every decision that we make, every move that we make has one thing in mind: how can we better serve our patients in our community? And and that's really the heart of everything, is how can we be better serving
Yeah.
And it could not be more proud of what Good Shepherd can do for our communities.
Yeah, it's like that urgent care you were talking about. Location is key to everything.
Yes, it is.
Accessibility is key to everything. And I think that's just gonna be a great addition to Hermiston, to Main Street,
Yeah.
to everything. So kind of looking forward to that,
I am
urgent care.
too. I can't wait.
And is that urgent care gonna be open 24 hours a day, or is it gonna be limited to just working hours, daytime working hours?
That's hard to say right now. I can tell you what the vision is. And the vision is to be open from 7 A until around 8 or 9 P. And so that's
a pretty good good hours.
That's really the vision. And the goal is to keep people out of the ER if they don't need to go to the ER.
Right.
So that's what we're hopeful to do.
Yeah. Yep.
And so it's going to be exciting. I can't wait till we get it up.
That is exciting. Well, I am just excited to be sitting here talking to you about this, patient care philosophy, your needs assessment, things that are happening. So if any of you guys have any more questions for Brian today, you can leave them in the comment section. We're just about done actually, but we can always, if there is any more information, is there a good way that they can contact if they have other questions that come up from our conversation today, or just call the main office and call, or?
You know, I think that depending on where the question is,
Right.
you know,
Yeah.
if it's about the clinics, I would suggest you just call the clinics themselves. You can always call administration, and somebody will get back with you. I guarantee you that, even if it's me. And I've done that.
That's
a couple
great
times.
to hear.
I've done that a couple times because I felt like it was important enough.
Yeah.
So it's just call administration, call our clinics, call our quality control. I mean, just call somebody. Call Liz Marvin.
Right.
You know?
Call the foundation.
Call
Liz
the
Marvin.
foundation.
Yeah. Right.
Because I guarantee you that if the questions get put out there, somebody's going to find the answer, and we'll get back to you. That's for sure.
Perfect. That is great. You know, that open door policy is the best way to really show patient care and patient that they're important. So
That's
perfect.
absolutely right.
Yeah. Well, thank you again for today's discussion. I just want to say thank you, and thank you to all of our viewers who joined us today. And we look forward to our next chamber talk with Torrie. I hope everybody has a great afternoon, and we'll see y'all later.